Hello everyone, myself Dr. Nitesh Singhal, currently an intern in Bengaluru. So this video I had made about the brainstem syndrome, and why I had made this because I think brainstem syndrome is one of the most volatile topic in the whole of the anatomy. So we will see some points, we will discuss some points by which we can differentiate all the various syndromes, and at last we will able to solve almost all the questions came in INICET and NEET PG regarding this. So yeah, the question they have asked is this, and I think this is one of the most difficult question they had asked. So we will just read it once and we will solve it later. Weakness on the right side of the face with loss of pain and temperature, and pain and temperature is also lost in left leg. So where is the lesion? So we will see this after completion. So coming to anatomy, so as we all know that brainstem consists of three parts. So first is अपना midbrain, then pons, and then medulla oblongata. So medulla oblongata consists of pyramid, and which is medial, and olive. As we all know, this is pons, and see this is mammillary bodies, and remember MB is in front of MB, means MB के आगे MB. mammillary body है ventral side पे मिड ब्रेन के, और मिड ब्रेन के पीछे क्या है कॉर्परा क्वाड्रिजेमिना, सुपीरियर कॉलिकुलाई, inferior कॉलिकुलाई. So the same thing is in this image. We can see here is the pyramid, here is the olive, this is the pons, and this is the mammillary body. So coming to vascular anatomy, this is important to understand, and this is very easy. We don't have to rectify or something. हमें कुछ डरने की ज़रूरत नहीं है इसमें. इसमें क्या है ना कि why we are discussing this, because we have to differentiate that which artery is involved in which of the syndrome. So coming from starting from the below, that is medulla. So हम अपने आप देख रहे हैं स्कीमेटिक डायग्राम में कि वर्टिब्रल आर्टरी जो है ये हमारी, इट इज़ रनिंग ऑन मेडुला. सो वी कैन से दैट मेडुला सिंड्रोम जो होंगे, चाहे लेटरल मेडुलरी हो, मिडिल मेडुलरी हो, वो इन्वॉल्व करेंगे वर्टिब्रल आर्टरी को. ऑब्वियसली ये तो हमें इससे देख के पता चल रहा है. अब ये जो हमारी बेसिलर आर्टरी है, तो बेसिलर आर्टरी कहाँ पर रन कर रही है? अपना पॉन्स पे. तो हमें पता है कि बेसिलर आर्टरी के मतलब जो पॉन्स पे, चाहे लेटरल हो या फिर मीडियल हो, so it will involve basilar artery. And this branch, we can see that branch posterior cerebral artery. See why posterior? Because it is on posterior to the cerebral, means so this is involved in midbrain syndrome. So we can understand by this diagram, so which artery is involved in which part of the syndrome. So what is vitamin CD? So as we all know that subclavian artery की ब्रांच होती है विटामिन सी डी का निमोनिक है. तो वी से हो गया वर्टिब्रल आर्टरी, आई से हो गया इंटरनल थोरेसिक आर्टरी, एंड टी फॉर थायरोसर्वाइकल ट्रंक, एंड सी फॉर कोस्टोसर्वाइकल ट्रंक, एंड डी फॉर डोर्सल स्कैपुलर आर्टरी. सो सेम थिंग इज हेयर. सी दिस इज अपन vertebral arteries, and vertebral arteries give one anterior branch, what is anterior spinal artery, and posterior two branch, that is pica, posterior inferior cerebellar artery. बेसिलर की कौन कौन सी ब्रांच है हमने देखी कि ये तो बेसिलर हो गई. बेसिलर ब्रांच कौन सी दे रही है? एक तो आइका दे रही है, AICA, आइका, एंटीरियर inferior cerebellar artery, cerebellar artery. एक हमारी सुपीरियर सेरिब्रल आर्टरी दे रही है, एक हमारी पोस्टीरियर सेरिब्रल आर्टरी दे रही है. जो तीन ब्रांचें बेसिलर की हैं, तो इसमें हमें ज़्यादा जाना नहीं है. जो ऊपर हमने डिस्कस किया कि देखो कि वर्टिब्रल इज़ रनिंग ऑन मेडुला, एंड बेसिलर इज़ रनिंग ऑन पॉन्स, एंड जो PCA है, दैट इज़ पोस्टीरियर सेरिब्रल आर्टरी विच इज़ द ब्रांच ऑफ बेसिलर आर्टरी, इज़ इन कम्युनिकेशन विद द मिड ब्रेन. सो हमें मेनली तीन ब्रांच याद रखनी है. अब आते हैं, या दिस इज़ द क्वेश्चन, विच आर्टरी इज़ नॉट contributing to the circle of Willis. So again going back to that diagram, so as we can see this is the circle of Willis, and we can see this is the middle cerebral artery branch of internal carotid. It is going lateral, so obviously we can see it will not contribute to the ICA. Okay, yeah, so this is middle cerebral artery is branch of internal cerebral artery and not contributing to the सर्कल ऑफ विल्लीज. सो हमें कुछ आर्टरी अब याद नहीं करनी, हमें पता है कि वर्टेब्रल आर्टरी जो मेडुला पर रन कर रही है तो ऑब्वियसली वो मेडुलरी सिंड्रोम में इन्वॉल्व होगी, और जो बेसिलर आर्टरी है वो पोंटाइन पर रन कर रही है तो पोंटाइन में इन्वॉल्व होगी, और जो उसकी ब्रांच है PCA पोस्टीरियर सेरिब्रल आर्टरी, सो इट विल इन्वॉल्व इन मिड ब्रेन. सो कमिंग टू नेक्स्ट slide. Yeah, one more thing about that optic chiasma, why I mentioned this one. See, wait one second. Yeah, this diagram. See, so try to label by yourself. This is the vertebral artery joining to form the basilar arteries. This is the branch from the basilar artery, posterior cerebral artery, and this chotu sa branch is superior cerebellar artery. Both are the branches of basilar artery. So we can see that in between of PCA and SCA, this one yellowish structure or nerve passing through it. So this is the third nerve passing through it. So, and which is this artery? This is the posterior communicating artery, branch of BA. No, this is the branch of ICA, but we don't have to remember, just for the completion sake I am telling. So PCOM. अब हमें पता है कि this is posterior communicating artery. If its aneurysm occur, so it will impinge on third nerve. So what we will get? So अगर posterior communicating artery का aneurysm होता है, so it will impinge on optic chiasma. So we will get heteronymous hemianopia. Heteronymous hemianopia, or also called as bitemporal hemianopia. And please don't confuse it with the, because I so many times I confused it with the optic radiation or the lesion below the optic radiation, which is homonymous hemianopia. So again, optic chiasma, because it will cause bitemporal, so means different side. So it will cause heteronymous hemianopia, and optic radiation or the below region will call homonymous, because same side lesion means left or right side of the both eyes, same side. Okay, then yeah, this is over, and coming to now nervous cranial nerves. Yeah, so coming to cranial nerves, so again see what we have to just remember, already we have done half part. What is that कि blood supply क्या है? So from one second. For medulla it is vertebral artery here, and for pons it is basilar artery, and for midbrain it was posterior cerebellar or cerebral, because cerebellar artery here, it will come here like this. Okay, so now we will just fastly we will see all this thing, that nerve supply. One second, I will delete it. Yeah, so just for the completion we will see all the nerves passing. See, this is the optic nerve, and this is the oculomotor nerve, third nerve. This is the fourth nerve. So why this is important? Because it will tell that which nerve is involved in which syndrome. So first we will see what is rule of 12. So rule of 12, what is, everyone knows I think, rule of 12 ये कहता है कि 3, 4, 6, 12 means factors of 12. These 3, 4, 6, 12 are the medial nerves means ये medial side को आएंगे. Okay, so So all this nerve will be medial. And one more thing we have to remember that M से medial और M से ही motor means M से जो medial होगा M से motor. तो जो motor symptoms होंगे ना like hemiplegia, this will be seen in medial syndrome, whether it can be medial midbrain syndrome or medial pontin syndrome or medial medullary syndrome. So coming back to that this one, yeah, we will see first schematic diagram. So we can see this is the third nerve, is a trochlear nerve. And what's so special about trochlear nerve? So first of all we can see that third nerve is in the communication around the midbrain. हमें ये याद नहीं करना कि लोकेशन कहाँ पे, ये सब बस हल्का हल्का थोड़ा माइंड में होना चाहिए so to solve the questions. So occipitator is near the midbrain and trochlear is also near the midbrain. So what we can see, and what is the features of trochlear nerve? So this is the only nerve which take a loop, means पीछे जाती है फिर वापस बाहर आ जाती है, come forward. First it go dorsally, then it come to ventral. So obviously it is taking a loop, so it will have a longest intracranial course. And second thing is it is डिकसेटिंग इंटरनली ओनली, मतलब कि मिड ब्रेन के अंदर ही डिकसेट हो जाती है. और थर्ड पॉइंट इट इज़ द थिनेस्ट एंड द स्मॉलेस्ट नर्व. फोर्थ नर्व, सो फोर्थ इज द थिनेस्ट स्मॉलेस्ट इंटरनल डिकसेटिंग एंड डॉर्सल लॉन्गेस्ट इंट्राक्रेनियल कोर्स. तो हमें थर्ड और फोर्थ तो पता चल गया, चलो ठीक है कि थर्ड नर्व इज relation with the midbrain. Now coming to this is trochlear nerve. अब trochlear nerve 3 4 देखो, थर्ड एंड फोर्थ हमने कहा था कि रूल ऑफ 12 के हिसाब से मीडियल होनी चाहिए, तो मीडियल ही है ना, ये थर्ड हो गया और ये फोर्थ हो गया. अब फिफ्थ इज ऑन लेटरल साइड पॉन्स में. सिक्स्थ should be according to rule of 12 it should be on the medial side, so it is in the medial side only. So medial side, and seventh, eighth are on the lateral side. So we can see sixth, seventh and eighth nerve are in relation with the pons. We can see here, no, again we will see sixth nerve at the pontomedullary junction, seventh nerve also and eighth nerve also are the pontomedullary junction, at the pontomedullary junction. Now again coming down to 12th nerve. See, again we will see the rule of 12. Rule of 12, what it's saying that 3 4 6 12 will come medially. So again we can see this nerve. What is this nerve? 12th nerve, no, this is 12th nerve. This is medial between the pyramid and olive. And this ninth nerve, 10th nerve and 11th nerve, 9th 10th 11th are lateral. So we can understand, okay, कि 12th nerve, 9 10 11 12th nerve are related to what syndromes? मेडुलरी सिंड्रोम्स. अब हमें इतना पता चल के देखो मेडुलरी सिंड्रोम्स के साथ कौन सी आर्टरी इन्वॉल्व होती है, हमें पता है वर्टिब्रल आर्टरी. कौन सी नर्व इन्वॉल्व होती है, हमें पता है मीडियल जाएंगे तो ऑब्वियसली कौन सी होगी, 12th नर्व. लेटरल जाएंगे तो 9 10th 11th नर्व होगी. अब पॉन्स पे आते हैं. पॉन्स में क्या होता है कि वी नो दैट पॉन्स इन्वॉल्व बेसिलर आर्टरी एंड विच नर्व्स आर एसोसिएटेड विद इट, 6th 7th. एंड अब उसके ऊपर भी जाएंगे मिड ब्रेन पे, तो मिड ब्रेन पे हमें पता है बेसिलर आर्टरी की वॉट विच ब्रांच, पोस्टीरियर सेरिब्रल आर्टरी एंड विच नर्व्स आर इन्वॉल्व, थर्ड नर्व इज इन्वॉल्व. ओके, तो हमारा ऑलमोस्ट सब कुछ हो गया, बस हमें कंसोलिडेट करना है. तो ये डायग्राम है, इसमें दोनों क्या है, एक वी हैव टू फोकस बिकॉज वी हैव टू कीप इट बोथ आर्टेरियल सप्लाई एंड वेस्कुलर सप्लाई, arterial and cranial nerves in the mind, so we can differentiate between the syndromes. So now coming to proper syndromes. Yeah, this is over. This is, so one question it was which nerve is this. So we can see we have discussed that this is first of all medial or lateral. This is medial, so it can be 3 4 6 12, and it cannot be 3 and 4 because 3 and 4 will come where, it will come here midbrain, and it can be 6th because it come at pontomedullary junction and it is medial side. So it's how easy it is, just we have to apply the logic, common sense. Then coming to proper syndromes. Yeah. So one thing this type of I want to discuss कि जो भी हमारे मीडियल सेट के सिंड्रोम होंगे वो या तो एम से स्टार्ट होगा या फिर डब्ल्यू से स्टार्ट होगा. एम का अपोजिट डब्ल्यू. लाइक सबसे पहले क्या होगा कि हम मिड ब्रेन का बात करते हैं. तो मिड ब्रेन में सबसे पहले क्या है, मिड ब्रेन का हमने बोला कि जो मीडियल साइड के ये जो भी है इट्स ऑन मीडियल साइड. मीडियल साइड में जो भी हमारा सिंड्रोम होगा वो होगा आपका या तो एम से स्टार्ट या फिर डब्ल्यू से स्टार्ट. सो फर्स्ट वी विल स्टार्ट विद द मिड ब्रेन. सो medial midbrain is called as Weber's. Okay, and now coming to Pons. So Pons medial Pons syndrome is Pontin syndrome is called as Millard Gobler syndrome. So again it is starting with M. Now with the medullary. So medullary के नाम में M है, medial medullary. ठीक है. तो अब इसका एक और नाम है दैट इज डीजरन सिंड्रोम. तो अब इसको कैसे याद करें डी और एम को. हम वी कैन लर्न दैट वी आर प्रिपेयरिंग फॉर नीट पीजी टू गेट एमडी सीट. सो मीडियल मेडुलरी. सो एम से डी, एम डी वी आर लर्निंग फॉर नीट पीजी एमडी सीट अगेन. सो नाउ वी हैव लर्न दैट जो भी मीडियल साइड का सिंड्रोम होगा वेदर इट इज मिड ब्रेन पॉन्स और मेडुलरी. सो it will start with M or M का opposite W. So now we have learned this much. One more thing I want to remind, or we have learned already, that medial syndrome, one thing is that M or W. One more thing, what? M से M से motor. So all the motor symptoms like hemiplegia will be involved in the medial syndromes. A medial syndrome can be midbrain syndrome, Pontin syndrome, or medullary syndrome. But already we have ruled out other three options, like lateral we have ruled out. So these at least ये वाला symptom तो होगा ही हर जो भी medial side का syndrome होगा. तो coming now to proper syndromes. तो अब जल्दी जल्दी देखते हैं एक बार. इसमें कुछ नहीं है, बहुत ईजी ही है. सबसे पहले कमिंग टू मिड ब्रेन. सो जस्ट फॉर द completion or understanding I have put this diagram, but I think it's of little use. First of all, coming to Weber's. अब Weber's में पता है W आ रहा है तो obviously it's a medial syndrome. One second. और हमने इसमें क्या पढ़ा था कि मेडुलर से कौन सा नर्व रिलेटेड है, थर्ड नर्व. तो अब इसमें कुछ हो गया बस ये कंप्लीट. वेबर्स में क्या होगा, कॉन्ट्रालैटरल हेमिप्लेजिया दैट इज मोटर सिम्टम प्लस थर्ड नर्व पैल्सी. So many other symptoms, other involvement is also there, but just we have to solve the question. So that's why this is enough. Believe me, we can learn everything now, but at last nothing we will able to remember. Only 2-3 points that we have revised that is important, that only we will able to recall. So learn that much only, that which is useful and important, and from which we can solve the questions. So W Weber's का हो गया. अगेन थर्ड नर्व पैल्सी प्लस contralateral hemiplegia. And why contralateral hemiplegia? Because we already know कि this is pyramidal tract is involved in this. So pyramidal tract is the continuation of corticospinal tract. Corticospinal tract is the motor, and at lower medullary it will decussate to the opposite side. So that's why opposite side it will decussate. So it is contralateral and it is motor. So it will be hemiplegia will be seen. Same thing सो अगेन डब्ल्यू हो गया, वेबर्स हो गया। अब लेटरल मेडुलर सिंड्रोम क्या होता है वो भी देख लेते हैं। लेटरल मेडुलर सिंड्रोम का नाम हो गया आपका बेनेडिक्ट सिंड्रोम। तो इस पेन में पता नहीं, बेनेडिक्ट सिंड्रोम। अब अगेन वी हैव टू गो बैक एंड जस्ट सी। सो बेनेडिक्ट सिंड्रोम में क्या होता है कि सेवंथ नर्व इज ऑल्सो इन्वॉल्व एंड थर्ड नर्व इज ऑल्सो इन्वॉल्व, लेकिन हमें बस उतना याद करना जितना ज़रूरी है। तो बेनेडिक्ट में वी कैन राइट थर्ड नर्व ऑल्सो इन्वॉल्व, सेवंथ नर्व ऑल्सो इन्वॉल्व, प्लस क्या होगा दिस थिंग लेमिनिस्कस, दिस लेमिनिस्कस। व्हाट आर लेमिनिस्कस? लेमिनस मीन्स ऑलरेडी क्रॉस्ड हो चुके हैं, तो जो भी फीचर होगा कॉन्ट्रालैटरल साइड के होंगे। सो जल्दी से एक बार लेमिनस डिस्कस कर लेते हैं, बट इट इज़ नॉट इम्पॉर्टेंट टू डिफ्रेंशिएट बिटवीन द सिंड्रोम्स। लास्ट में क्या करेंगे ना, वी विल कंसोलिडेट ऑल द सिंड्रोम्स विद इन 1 or 2 लाइन्स। जस्ट सी फॉर नाउ। सो बेनेडिक्ट में क्या होता है ना कि सेवंथ नर्व, अब सेवंथ नर्व, बट हमने अब ये सेवंथ नर्व मिड ब्रेन में कैसे आ गए? हमने वी हैव लर्न द सेवंथ नर्व इज इन्वॉल्व इन द पोंटाइन। सेवंथ नर्व तो पोंटोमेटिक जंक्शन पे थी ना, ये इफ यू रिमेंबर, जस्ट वी विल सी फास्ट या दिस वन। Seventh nerve is coming here. This is the seventh nerve. This one is the seventh nerve. So why it's coming on the in the midbrain syndrome? Because just I'll go there. See in the diagram we have written here frontopontine fibers of the seventh nerve. This frontopontine is what? These are the cortical fibers, and cortical fibers, as we know, these are the upper motor neuron fibers. And just remember that what are the upper motors and lower motor, we will briefly discuss here only. See, or I will take another page. See, upper motor neuron is cortex fibers, and lower motor neurons consist of the cranial nuclei or anterior horn cell plus the nerve starting from that. So as we know that frontopontine means it is coming from the frontal cortex and going to pontine. So it will be obviously it will be the upper motor neuron, because where is the nuclei? Where is the cranial nerve nuclei of the seventh nerve? It is in the pons. So obviously जो क्रेनियल नर्व के न्यूक्लिया के पहले फाइबर्स होंगे वो क्या होंगे? कॉर्टेक्स अपर मोटर न्यूरॉन होंगे. सो वी विल सी इन बेनेटिक्स व्हाट? In Benedict we will see seventh nerve palsy, but what? Upper motor neuron. Upper motor neuron में क्या क्या आता है? Contralateral facial paralysis. That's all. और प्लस लेमनिस के फीचर. लेमनिस के फीचर बहुत ईजी हैं. वी विल डिस्कस एट लास्ट, बट इट्स नो यूज. वी कैन डिफरेंशिएट लाइक दिस ओनली. तो हमने पढ़ा, देखिए डब्ल्यू से क्या था? वेबर्स. तो वेबर्स में हमने पढ़ा था क्या? थर्ड नर्व पाल्सी को हमने देखा था. थर्ड नर्व न्यूक्लियाई का कहाँ पे आता है? इन मिड ब्रेन. देन कॉन्ट्रालैटरल हेमीप्लेजिया बिकॉज ऑफ पिरामिडल ट्रैक्ट. एंड बेनेडिक्ट में क्या था? बेनेडिक्ट में था सेवंथ नर्व पाल्सी, अपर मोटर न्यूरॉन, कॉन्ट्रालैटरल लोअर हाफ of face. My handwriting is very very bad, I know, sorry for that, but yeah, it's like this only. Now coming to pontine. So pontine is also very easy. First of all we will discuss about medial side. So medial means Millard, MCM, Millard-Gobler syndrome. Millard-Gobler syndrome. अब one feature तो already we know, contralateral hemiplegia because of pyramidal tract. And second feature, now we can what? Which nerve will come? Either sixth nerve can also become, because it was on pontomedullary junction, and seventh nerve can also come. See here also we can see sixth nerve, seventh nerve, sixth and seventh nerve. Here also, yeah, sixth nerve, it will cause what? It is supplying the lateral rectus, no? So it will cause lateral rectus palsy. So it will cause medial or convergent squint. So we have done Millard-Gubler also, and it's very easy. So Millard-Gubler we have done, and so we can remember, sixth nerve is involved plus contralateral hemiplegia. That's all done. But seventh nerve is also involved. We can or we cannot remember. It's our wish. The seventh nerve, but here see pontine. So we say that nuclei of facial nerve is in the pontine, pontomedullary junction. So after that the fibers will be nuclei and the fibers will be lower motor neuron. So lower motor nerve facial paralysis. And what is seen in lower motor neuron facial paralysis is the ipsilateral complete ipsilateral facial face is involved. Okay, so there was contralateral half of face. Why? Because of upper motor neuron. It is upper motor neuron is involved, because midbrain, the fibers of the in the midbrain side of the cortex, coming from the cortex, they haven't came back to the neuron, which is in the pontine. Okay, yeah, so this is over. This is our Millard-Gubler. Now after Millard-Gubler, this is lateral pontine. Lateral pontine, we know seventh nerve is involved, and more laterally will go, so eighth nerve is also involved. So we can say seventh and or eighth nerve involved plus lemniscus features. See, seventh nerve is involved in both lateral pontine and in medial pontine, that is Millard-Gubler. But we have to remember it? No, because we know that eighth nerve to involved in lateral pontine. But if they haven't mentioned eighth nerve, only mentioned seventh nerve, so how can we differentiate? We can differentiate based on the contralateral hemiplegia. If contralateral hemiplegia is present, so this will be the Millard-Gubler. If contralateral hemiplegia is not present, or any lemniscus features like contralateral loss of pain, touch, pressure, fine touch, proprioception, so it will be lateral pontine. So lateral pontine ka how it will cause? It is caused by the acoustic neuroma. Okay, caused by the acoustic neuroma. So once again we will see that picture of the, where is that picture? Yeah, this one. So this is pons, superior cerebral peduncle, middle cerebral peduncle. See, if cerebral peduncle is involved, so obviously it is lateral. So ataxia will be there. Ataxia is again the feature of the medial or lateral. Obviously it is lateral because it is lateral side. Coming to at last medullary syndrome. Again, it is simplest. So we will go to that diagram. Which diagram? First one. Yeah, this one. Again, medulla involved which nerve? Medial side. Medial side it is 12th nerve. We can see now this is 12th nerve. So medullary. Okay, or else I will add there only. Wait. Medial medullary. What is the other name of medial medullary? MD. हमें MD करना है. Medial medullary. So 12th nerve, because 12th nerve तो बीच में आती है, medial side में आती है, प्लस हमारा evergreen contralateral hemiplegia. So 12th nerve is supplying what? Tongue. So tongue paralysis means Genioglossus is involved. And remember, if suppose one question came, if right side, one second, if right side tongue paralysis is there, so which side of the nerve is affected? Think. So if right side tongue is affected, so right side 12th nerve is affected. Remember, ipsilateral side, not contralateral side. And suppose any different question not related to this, if one question came, if facial palsy is there, facial palsy and mouth deviated to left side, then which side of the nerve is involved? So here the answer will be left or right. Here will be right side, because if right side nerve is involved, so left side muscles will be normal, so they will pull the mouth to the different side. In genioglossus it's ulta. Normally genioglossus will push the muscle tongue to the opposite side. So if the right side is involved, so it will come back to right side only, to the same side. Okay, so it's just we have seen extra point. Coming back to medullary syndrome. Yeah, first we'll do. So medial medullary, this is Dejerine syndrome. Remember the Dejerine. So 12th nerve and contralateral. What will be in the lateral? Lateral to और भी easy है. Only how many nerves left? 9, 10, 11. So 9, 10, 11 means bulbar palsy. Bulbar palsy means dysphagia, dysphonia, all these things. Dysphagia, dysphonia, or we can say that nucleus ambiguous is affected here. Nucleus ambiguous. Can anyone think? We should correlate all these things. Ki nucleus ambiguous is come in which spinal nuclei or cranial nerve nuclei? Different columns are there, no nuclei. Which column of nuclei? So it will come in SVE, spatial visceral efferent. That is the column for the pharyngeal arch muscles. Okay, so we have done all the basic syndromes. So yeah, my handwriting is very bad, please bear with me. So again, now we will try to consolidate all the syndromes at one place. So first we started the midbrain. I am new to this, that's why it's happening with me like this. Midbrain syndrome. So first we see medial. Medial, what we learn? So contralateral hemiplegia, so is common. I will not write okay. In this I will write contralateral H plus third nerve palsy. Okay. अब थर्ड nerve palsy में ये ध्यान रखना दिखेगा क्या क्या. थर्ड nerve palsy में क्या दिखता है? वही सब टोसिस दिखेगा और क्या दिखेगा? स्क्विंट दिखेगा. टोसिस. स्क्विंट कैसे दिखेगा? कन्वर्जेंट डाइवर्जेंट? ऑब्वियसली डाइवर्जेंट, बिकॉज कन्वर्जेंट we are seeing in convergent squint in the sixth nerve palsy. Why in sixth nerve palsy? Because lateral rectus is involved, so the eye will be shift to the medial side, so here it will be divergent squint. Done. Now lateral MB syndrome. So here what we learn? Seventh nerve is involved, that's all. Done. Seventh nerve, yeah, we can lemniscus also. We will discuss lemniscus. Seventh nerve. Okay. Now coming to pontine. Pontine is, first we will take medial side. So Millard Gubler syndrome. One second, I will tell you. Millard Gubler syndrome. Contralateral hemiplegia plus sixth seventh nerve. Sixth nerve is what? Convergent disc. Seventh nerve is lower motor neuron. यहाँ पे seventh nerve क्या था? Wait, I will write with different color so we will remember this. Upper motor neuron, that is contralateral lower face. Here ipsilateral complete face, complete side face. Okay, this is also done. Now coming to lateral pontine syndrome, that is by acoustic neuroma. So seventh nerve और eighth nerve प्लस eighth nerve है तो obviously eighth nerve तो कहीं दिखेगी नहीं, we will not see eighth nerve anywhere else, so it is obviously lateral pontine plus what? Lemniscus features. Done. Now coming to medullary syndrome. So medial medullary, that is degerens. This is the simplest. Same side ipsilateral tongue 12th nerve. 12th nerve, that is same side tongue deviates plus contralateral hemiplegia. Lateral, इसका भी कुछ नाम होता है क्या? लेटरल का होता है वॉलेनबर्ग. लेटरल मेडुलरी सिंड्रोम, इसमें क्या होता है? बल्बल पाल्सी. बल्बल पाल्सी मीन्स 9, 10, 11 plus lemniscus features. Okay, now we will see lemniscus first. We will see. Yeah. Second. We will see the diagram. Yeah, this diagram. See, remember MTSL. One more is the MTSL. So what is this? See, we can see it will go lateral only. In this picture also you can see, not in this one. Yeah, this one. Okay, here they haven't mentioned. So lemniscus means lateral, LC lemniscus, LC lateral. Or in picture also we saw it is coming like this, lateral side. So what is the lemniscus features? We will see here only. See, MTSL, M से medial lemniscus. Medial lemniscus is formed by the dorsal. Dorsal means what? Dorsal is sensory, dorsal column tract. So obviously it will carry sensory this one, sensation. So which sensation? Fine touch and proprioception. We have to remember this. And remember, dorsal column is joined with the anterior spinal thalamic tract also. ASTT. This is the question, previous year question. They haven't mentioned the dorsal column tract and they have just mentioned ASTT and LSTT. We will come to that. So yeah, ASTT also joined with them dorsal column and from medial lemniscus. But the main answer is this one, dorsal column. Now MTSL. T say we all know, trigeminal, supplying sensation to face, pain. Or remember, lemniscus means, I will write with other pen, lemniscus contralateral. Lemniscus means contralateral. So contralateral side of contralateral loss of face, pain and temperature. Spinal MTSL. So spinal lemniscus formed by, here it is anterior spinal tract, it is ulta, LSL, LS, lateral spinal thalamic tract. So sensation from the body, rest of the body. And lateral lemniscus, we all know that ecolyma only. What? Yeah, so MTSA. So if question mentioned that patient is having dysphagia, dysphonia plus contralateral side of the loss of pain and temperature, our answer will be lateral medullary, that is Wallenberg. Okay, so understood, this is about the brainstem syndrome. And firstly, it's extra stuff, but they haven't asked this one, but we can discuss this also. Yeah, these three one. This is one Northangal syndrome. Just remember, in this Northangal syndrome is third nerve is involved plus cerebral peduncle is involved. See, all these are all these are extra midbrain syndrome only. Midbrain syndrome. Northangal is third nerve is involved, means tectum is involved actually in here. Tectum is dorsal. We want to see one picture here. Where is the picture? Yeah. This is the tectum, tegmentum, and crus. Okay. So here tegmentum is involved, and what are the features of Northangal is third nerve, palsy plus here also superior cerebral peduncle is also involved. So here will be ataxia. Claude is third nerve plus ataxia plus tremor. Why tremor? Think tremor is because of red nuclei. So what is the, or we will what generally we are saying here means it is mentioned कि Claude is equal to Northangal plus Benedict. When Benedict also we can see tremors because it can also involve the red nuclei. Simple. Perinode. So P से perinode. So what is the cause of the pineal gland tumor? Where is the pineal gland? How we will know where is the pineal gland? So we will know by this. See, here is the pineal gland, and pineal gland is dorsal or ventral? It is dorsal side. So dorsal side. So it will cause dorsal midbrain syndrome. So midbrain के आगे क्या था? यहाँ पे था mammillary body. यहाँ पे क्या होगा आपका colliculi, that is corpora quadrigemina, superior colliculi, inferior colliculi. So dorsal. So pineal gland tumor, it will impinge on the colliculus. So what it will cause? It will affect the eyes. Superior colliculi. Remember, superior colliculi is for superior. That is eyes. Eyes superior है. Inferior colliculi is for inferior. Eye ear नीचे है. So it is for inferior colliculi. So in perinodes, what we are saying कि upward gaze palsy is there. So what is the position of the eyes? Downward gaze. It is also called Doll's eye sign. Okay, just we have to remember this one. They haven't asked all these things, just for the completion sake we are discussing. See, P say pineal gland tumor. Pineal gland tumor is impinging on the colliculi, that is dorsal midbrain syndrome, or dorsal of the midbrain. So P say perinode syndrome. And what is it causing? It is causing the upward gaze palsy. So what is the position of the eyes? It will not able to move upward, so it will be downward. Downward gaze is seen. Downward gaze is seen means Doll's eye sign is seen. So this was about the brainstem syndrome. I know this is a long class. I thought it will be very short class. This is after very long time I'm discussing on YouTube, on making a video as per se. So hope you like all these things. Try to see it full. I know it's a bit lengthy, but see on 2x. And please give me suggestions. Whatever your suggestions will be, please put in the comment box. And लाइक शेयर सब्सक्राइब इतना तो बनता है यार. लाइक लिख देता हूँ, लाइक शेयर सब्सक्राइब. एंड माई इंस्टा ID इज़, या मैंने लिखा था उसको अलग से, नहीं है, लिख देता हूँ, फ्री सोल INFP. Okay, free soul INFP. So yeah, hope you like it. Any suggestions, please put in the comment box. And one more thing I just want to share. Yeah, this one. So as we all know, today is Sunday, 28th May. So our Prime Minister has inaugurated our new parliament. So congratulations to all. Okay, bye. See you in the next video.